to meet you. I am Heejeon Suh from Dongmyeong University. I will present today social emotional characteristics of young children according to presence of atopic dermatitis symptoms. The contents are there like this. Introduction, I will explain about atopic dermatitis symptoms and purpose of this study. And second, method, I will describe about subjects and research instrument and data analysis. Third, research results, and last one is conclusion. Atopic dermatitis symptoms is one of the chronic allergic diseases commonly found in childhood. Atopic dermatitis occurs from infancy and refers to chronic recurrent eczema disease accompanied by severe itching, erythema, and scale. The causes of atopic dermatitis include genetic background, food allergies, immunological abnormalities, skin barrier abnormalities, environmental factors, social factors, and various causative factors such as psychological relationships. Examining previous study related to peer interaction of children with atopic dermatitis, some report it is known that children with atopic dermatitis tend to be immature and unsociable compared to healthy children. Psychological problems arise in the case of children with atopic dermatitis. This study aims to examine whether there are differences in children's problem behavior, peer interaction, and school readiness according to the presence or absence of atopic dermatitis symptoms. Second part is method. The subjects were 1502 young children who responded to the presence or absence of atopic dermatitis. And of them, 232 children, 15.4%, who have had atopic dermatitis symptoms till now after birth. And there were 1270 children, 84.6%, who have had not atopic dermatitis symptoms. To measure young children's social and emotional character, we can use three research instruments. First one is child behavior checklist. Second one, interactive peer play scale. Last one is school readiness scale. 36 items of internalization problem behavior and 24 items of externalization problem behavior are used. The internalization problem behavior is composed of sub-variable emotional responsiveness, anxiety, depression, physical symptom, shrinking, and externalization problem behavior is composed of attention problem and aggressive behaviors. The item reliability 0.56 to 0.79, and externalization item reliability was found to be 0.62 and 0.87. To measure children's peer interaction, this study used the scale PIPPS, Pan Interactive Peer Play Scale. This scale consists of 3 sub-areas such as play interaction, interference with play, and play break. We can use 30 items. To measure school readiness of preschool age children, we used school readiness scale. It consists of 4 factors such as social emotional development, attitude toward learning, communication, and cognitive development and general knowledge. The total item number are 22 items. Let me explain about data analysis. Descriptive status analysis and independent sample t-test was performed to verify the difference between variables. Third part, results. First one is differences in children problem behavior according to the presence or absence of atopic dermatitis symptoms. In the result of comparing the differences in the factors of problem behavior, internalization of children according to presence or absence of atopic dermatitis symptom, there were significant differences in emotional responsiveness, anxiety, depression, physical symptoms, and total score of internalizations. No differences in shrinking. It can be explained that in the case of children with atopic dermatitis symptoms, level of problem behavior internalization is higher than that of no symptom children with atopic dermatitis. In the result of externalization factors, the attention problem and aggressive behavior and total score all showed significant differences. The level of problem behavior externalization is higher than that of no symptom children with atopic dermatitis. This slide showed children's peer interaction result. In the table, 3 factors, play interaction, interfere with play, and play break. All factors, no differences between atopic dermatitis symptom children group and no symptom children groups. This slide's about school readiness. There was no difference according to the presence and absence. There's no differences. Lastly, I will explain about conclusion. First conclusion is about difference of problem behavior. In the result of comparing the difference in the factor of problem behavior internalization of children according to the presence or absence of atopic dermatitis symptoms, it was found that there was a significant difference in emotional responsiveness, anxiety, depression, physical symptoms, and a total score of internalization. This result can be explained that the level of problem behavior internalization in children with atopic dermatitis symptoms was higher than that of no symptom children. In addition, attention problem aggressive behavior and a total score of externalization which are the externalization factors of problem behavior, all showed significant differences. So, it can be explained that in the case of children with atopic dermatitis symptoms, the level of problem behavior externalization was higher than that of no symptom children group with atopic dermatitis. This result is consistent with that of studies showing that pediatric atopic dermatitis patients have more internalization problem and externalization problem such as aggression, impulsivity, and attention compared to the normal control group. Other reported reported that in the case of problem behavior, boys who experience atopic dermatitis in all dimensions of internalization and externalization problems score higher than inexperienced boys, but that girls show no differences in the presence or absence of atopic dermatitis experience. Subsequently, next studies, it is necessary to examine the difference in problem behavior of atopic dermatitis symptoms children group according to gender. Second, the sub-factor of peer interaction according to the presence or absence of atopic dermatitis symptoms such as play interaction, play interference, and play break showed no differences between groups. This result is consistent with the reported results of study. In case with not severe atopic dermatitis at the time, the students not having difficulty with the friendship, and also there was no differences in the peer interaction according to the presence or absence of atopic dermatitis at the age of 5 years. That is the consistent result. Third, even in the case of school readiness of preschool age children, it was found that there was no differences according to presence of atopic dermatitis symptom. These results are inconsistent with the result showing that atopic dermatitis affects children's emotional development and showed dysfunction in mind and body, and also inconsistent with the findings of that atopic dermatitis negatively affect school-age children companionship. In the case of children, atopic dermatitis can be seen as a different situation from the long-term progression of children in school age and adolescence. In childhood, the onset atopic dermatitis may be in the acute phase, and as the level of interest in appearance or self-identity is not established. In childhood, atopic dermatitis may have a small effect on peer interaction and school readiness. I will explain about limitation of this study and further studies. This study, the data of panel study on Korean children, PSKC, were collected through the ratings of teachers or parents. Therefore, there is a limitation of not presenting the integrated reliability. In the future, there is a need for complementary measures through quantitative and qualitative research. Second, this study was conducted on 6-year-old children. Therefore, it is difficult to generalize to all infants. Next study, we have to consider various variables: the age and gender of infants, the degree of atopic dermatitis symptoms, the residential environment, and the parenting attitude and emotional level of the parents, etc. It is necessary to use big data analysis method and conduct a long-term study integrated into real life for child patients with atopic dermatitis. Thank you very much. Thank you for listening. Thank you.